Welcome back. We're going to start on the lower appendicular skeleton now. We're going to begin with the pelvic girdle. Okay? We call it a girdle, not because it's tight and snappy, but because it goes around, completely around the skeleton. Okay? If you were to put on a belt, you would be girding yourself. If you have an animal that destroys the bark around the outside of a tree, you would gird the tree. So this is the pelvic girdle. It's made up of two important pieces. Okay, so one piece is, and I'm going to show you these individual pieces. Okay, I'm going to move this off to the side and grab a single piece of pelvis. Okay, so this is one side of the pelvis. We call this an os coxa. You have a right and a left. Okay, so in this case, this one would be my right os coxa. Okay. And then it's going to make an articulation or joint at the posterior part of the skeleton with, let's see if I can get that in there, with the sacrum from the vertebral column. Okay, so here's the sacrum or sacrum. Doesn't matter how you say it, it's fine. I love the name of this bone. I only kind of figured this out recently, but somebody way back when had a sense of humor. It's called sacral. It's from the same root word as sacred, and as many people know, sacred means holy. So this is a holy bone because it's got lots of holes in it. Somebody was making a pun back in ancient Rome. Okay, so let's take a look at our os coxa. The bones of the pelvis are made up basically of three portions that fuse together during development. The main big wing or flange up here is referred to as the ilium. The top of that ilium makes a crest called the iliac crest. It comes down here to sometimes somewhat pointy, sometimes it's not very pointy. So we call that the anterior iliac spine, and in the back it has a posterior iliac spine, superior and inferior. Okay. Because this is disc-shaped, our sign earlier for a fossa, that cup shape or disc-shaped, if you look at that sideways, it has a nice dish to it. That is the iliac fossa then. It's a piece of cake. Once you know the ilium, you can name all this other stuff. Okay, then we look at the front of the pelvis, and I think most people can remember this because back when you were in 5th or 6th grade, they probably started talking to you about the pubic area, and the pubis is the part that sticks out in front. Okay, so this is the anterior portion on our full pelvis. It makes a special joint right here, which is made up of fibrocartilage, the really tough stuff, and this is called the symphysis pubis, or pubic Symphysis. Either one's acceptable. One's the slightly older name, one's the more modern version. I kind of remember this as if you know a symphony, all the musical instruments play together, and so this is where the pelvis comes together, where it's making, beautiful music together. Okay, so that's the pubis. Okay, now the last portion is this lower portion, and that's the part you're sitting on. If you're sitting, most people sit on these. These are your seat bones. This is the Ischium or Ischium. Okay, either one is fine, whatever you're more comfortable saying, as long as you can spell it. I like Ischium because it kind of reminds me to put the CH in there, I-S-C-H-I-U-M. And I love these. This is my favorite example of a tuberosity on the body. Does that not look like a big potato? A big, white, oval, lumpy structure, so it's called the ischial tuberosity or ischial tuberosity. And you sit on that. That's your seat bones. The one your mom told you not to sit on the curb for too long, or at least my mom did, not to sit on a hard surface too long because they would get sore. They're the ones that get sore if you go horseback riding or on a real long, hard ride. They're the ones that hurt if you ride a bike for a really long time and you get off. The last couple of structures on here that students should know, in the back we have a couple of indentations. This one's not very pronounced. This inferior one is not very pronounced. In some skeletons it is quite pronounced. We call these notches, and we have the greater sciatic notch and the lesser sciatic notch. So that's where some of the sciatic nerve branches are going to pass around from behind to go down into that leg. And then I love this right here. This has a name that most of my students don't like, but if I tell you this story, maybe you can remember it a little better. It is called the acetabulum. Some people say acetabulum. A-C-E-T-A-B-U-L-U-M. And the purpose of this is obviously your hip socket. It's where that femur, it's a nice big socket, much more structured than the glenohumeral socket's going to be. But it's called an acetabulum because way back in Greek and Latin times, after dinner as a digestive aid, they would give people a little cup about the size of this with some vinegar in it to drink, which would help you to digest your food. And it was called an acetabulum. And so obviously when the first people were looking at these and naming them, they said, oh, that's just about the size of our acetabula that we drink out of after dinner, so we shall call it that. We don't use those anymore, so it's kind of a foreign word. And that's pretty much it that you need to know. Oh, one thing, when we have the pelvis together, we do describe, let me see if I can get this position just right. We describe this as sort of the upper part of the pelvis is open in front but closed behind because of these iliac crests, these wings. So the upper sort of half open area is referred to as the false pelvis, and the lower part is referred to as the true pelvis. And we describe these as being, there's the space right here, this hole at the top. Okay? We call that the pelvic inlet. It's the place that the baby's head would go in first. And then we call where the baby's head comes out. Of course, this doesn't matter as much to guys, but I mean, it should. If it's your child, you should care about this happening to your loved one. This outlet down here is called the pelvic outlet. So the outlet is where the head would come out, the lower part, and the inlet is where the head goes in. And if we want to tell the difference between male and female pelvises, we look at a couple of different things. So in a male pelvis, the coccyx will be curvy, will be anteriorly curved and will stick much more forward. In a female, it'll be more inferiorly curved. Let me just bend this a little to show you, so it'll stick more down. And so when you look through a female pelvis, this is a male, so I'll see if I can find the female. If you look through a female pelvis, you don't see the coccyx as much, but if you look through a male pelvis, you see the coccyx quite a bit. It actually makes the pelvic outlet, inlet outlet area look like a heart, kind of. Male, more of a heart, female, more of an oval. Imagine you want less obstruction to get that baby through. Okay, also if we look at the front of the pelvis, we would see that, oh, you know what? Actually, this is a female pelvis. So that would be down like that, and then we would see that oval. My mistake. And I can tell that because when I look at the front, this angle right here under the pubic symphysis, if this is about a 90-degree angle or less, if it's a narrower angle, then it would be male. But when it's wider than 90 degrees here, then that's female, which again makes sense to make this a broader pelvis in order for a baby's head to fit through there more. Okay? So that's it for the pelvis. Now let me take a quick look at our femur. Now femurs are big. I can't fit the whole thing onto this screen at once, so we'll start with the proximal end. Looks very similar to the humerus. I'm going to put the humerus back here with it. If you had them next to each other, you could really tell the difference because the femur has a very large, pronounced neck, and the head is at a distance from the main structure of the bone. But if I don't have them together, it is pretty easy to see that because this has a big structure opposite the head, and this has a head, and this has a head, you can see that they could be confused. So, we have, oh, one other thing I forgot to mention earlier when I was talking about the humerus too, bringing up necks, is that because there's not much of a pronounced neck here, we call this neck on the humerus the anatomical neck, but because it mostly breaks right here, this is where the bone breaks the most, we call this the surgical neck. So a humerus kind of has two necks because it really doesn't stick its neck out at the top. Okay? But on the femur, we definitely, this is the neck, and this is what we call the greater trochanter. Okay, now we were looking at the anterior side, but if you look at the posterior side, or sort of the medial side, you'll see another thing sticking out. This is called the lesser trochanter. Well, I got my trochanters and my tubercles mixed up for years. Couldn't remember which ones were in the arm. It sounded like trochlea, sounded like tubercle. So here's how I remember this. If you can remember that horses have one of their gaits, which is a 3-beat da-da-da, 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 kind of a running gait, is called a canter. And if you remember, horses only have legs. You only find trochanters in the legs. So that's how I remember it. The trochanters are in the legs, and once I figured that out, I never forgot it. As we move down, we don't see a lot of other features. On some femurs, you can see a nutrient foramen. You can't often see those on the polymer bones, although there is a little sign of a nutrient foramen here. It looks like a little hole where the blood vessels were in. And then on most femurs, you should be able to see like a spine down the backside, what we call a line, actually. This is the linea aspera. And bear with me for a second. wanted to show you a really developed linea aspera, but this one's moderately developed. We have some, the older a person gets and the more hard work they do with their legs, the more this will stick out. Okay, so it's where some of those adductor muscles and the muscles of the hamstring group and will attach, so, and glutes. Okay, so we're looking at the distal end of the femur, and on the distal end of the femur we have some lovely condyles. Okay, they look like a cylindrical smooth surface at a joint. So this is my symbol, okay, for a condyle to help you remember. We have two and then a space in between. So we'll have to figure out which side we're on. Here's the head. Here's the patella. This is the kneecap on the front. So this must be a right femur. So that means that this condyle is in the middle, that's the medial condyle, and this condyle is on the lateral side, that's the lateral condyle. And in between, the intercondylar fossa, a space between two condyles, so the intercondylar fossa. Okay. Also, just as we had up in the arm, in the humerus, we have areas that stick out on either side of my condyles, stick out farther, so we call these epicondyles. So we would have medial and lateral, okay, so we're going to have medial and lateral epicondyles. Okay. And then the patella sits on the surface. This one's still attached. There's a little flat spot under there called a facet, the patellar facet, or sometimes called the femoral facet, where the patella sits on the front of that femur. And that's about it that you need to know about femurs. Of course, the big shaft or diaphysis, okay, and very substantial epiphyses at the ends. All right.